Good day, everyone. My name is Adeolu Abiye. I'm a registered nurse and a public health practitioner. Today, we'll be talking about PCOS. What is PCOS? PCOS stands for Polycystic Ovary Syndrome. When we say something is polycystic, it means it's not just one cyst. There are multiple tiny cysts present on the ovary. So that's what we mean by polycystic ovary syndrome. It is a hormonal disorder that affects women of reproductive age. According to WHO, women of reproductive age are women from 15 years of age to 49 years. PCOS is a common condition affecting about 5 to 10% of women of childbearing age. So it is something we should be concerned about. What causes PCOS? The exact cause of PCOS is still unknown, but it is thought to be related to hormonal imbalance. Women with PCOS have high levels of androgens and low levels of estrogens. Androgens are found both in male and female, but it is higher in male than female, while estrogen is basically found in female. It could be as a result of genetics. PCOS tends to run in families. That is, it can be hereditary. For example, a daughter of a mother who has PCOS will likely have PCOS when she gets to reproductive age. Another cause of PCOS is insulin resistance. Many women with PCOS have insulin resistance, which can lead to high blood sugar levels. You find out that most of these women with PCOS have high blood sugar levels when they are tested for insulin levels. So let's move to the next slide. What are the symptoms of PCOS? The symptoms of PCOS can vary from woman to woman, but common symptoms include irregular periods, infrequent or prolonged menstrual periods. We all know that the normal duration for menstrual cycle from 1 month to another should be 21 days to 35 days, while the normal blood flow should be from 2 days to 7 days. Anything that does not fall in between these two ranges, just know that the period is already infrequent or it is prolonged. Another sign of symptoms of PCOS is weight gain. Many women with PCOS experience weight gain, particularly in the midsection. The midsection is that part between your chest and your hips. So your midsection is generally your abdomen and your lower back. So you notice that women with PCOS gain weight on this part. We have acne, which some people call pimples. PCOS is often associated with acne, particularly on the face, the chest, and the back. So you notice this acne on people with PCOS, particularly on their faces, on their chest, and the back. Excess hair growth. Some women with PCOS experience excess hair growth on the face, on the chest, and the back. So you notice that they have excessive hair growth. The fifth one is cyst on the ovaries. As we said earlier on, you will notice multiple small cysts on the ovaries. So it is also a sign of PCOS. Infertility is the peak. PCOS is a leading cause of infertility in women. When there's already irregular periods, it might be difficult for the ovulation to be regular. So it might lead to infertility. Let's move to the next slide. So how is PCOS diagnosed? PCOS is typically diagnosed based on a combination of clinical symptoms, medical history, and laboratory tests. This may include physical assessment. During the physical assessment, the medical practitioner is checking for those symptoms we have mentioned earlier on. Symptoms like the excessive hair growth on the face, on the chest, and the back. We have acne too on the face, on the chest, and the back. So these are the physical assessment the medical practitioner is checking. Medical practitioner also will check if there's excessive weight gain on the midsection. So the next thing is to take medical history. From the medical history, the medical practitioner will ask the patient if there's anybody in her family that has been diagnosed with PCOS before, and the medical practitioner also wants to know if there is any notable irregular menstrual cycle from the patient. So these are the medical history. Then there will be a pelvic examination to detect any form of abnormal growth or any form of abnormal organ detected while palpating the patient's body. Then the next thing is ultrasound to check for cysts on the ovaries. The ultrasound scan will confirm if there are cysts on the ovaries, because with pelvic examination you might not be sure if they are cysts or not, but with ultrasound scan you'll be able to vividly see the ovaries and note if they are cysts or not. The next thing is to do hormone level test. Remember, we said if there is high level of PCOS, of androgen hormones in the patient's body, it could note that the person is having PCOS. So with hormonal level test, we'll be able to know if the hormone levels are not balanced, that is a high level of androgen levels. So that will help. The next thing is to do glucose tolerance test to check for insulin resistance. If the blood sugar level is really high, that's another way of detecting if someone is having PCOS. It does not mean that everyone with high blood sugar level has PCOS. It could just be diabetes. So all this put together will make the medical practitioner confirm the diagnosis that this patient is having PCOS, or if the patient is not having PCOS. So let's move to the next slide. So what are the treatment options for PCOS? Remember, we said there is no cure for PCOS. So there are various treatment options which just include managing symptoms and improve quality of life. We have the birth control pills. I know you might be amazed that we are saying birth control pills. Yes, there are some birth control pills that can help to regulate menstrual cycle and reduce androgen levels. We also have fertility medications. For someone who is experiencing infertility, what will be the next thing to do? It will be that the doctor will prescribe fertility medications to stimulate ovulation and improve fertility. We have the anti-androgen medications to reduce excessive hair growth and acne. Then there is metformin. I would advise, please, no one should go for self prescription. Nobody should go and get metformin in the pharmacy. It should be prescribed by the medical doctor. Then we have lifestyle changes. You have to maintain a healthy weight, have regular exercise, and follow a balanced diet to manage symptoms. Remember, there is no cure for it. The only thing you can do is to manage the symptoms. So for someone who is having excessive weight gain, by having a lifestyle modification, the person will be able to have a healthy weight. So let's move to the next slide. The next slide, we'll be talking about people that already been diagnosed with PCOS. How do they live? What should they do? While PCOS can be challenging, there are many ways to manage symptoms and improve quality of life. It is essential to stay informed. That is, you educate yourself about PCOS and its symptoms. So once you know the symptoms, you know what it's all about, you are staying informed, and it will eradicate fear of the unknown. Then you need to seek support, connect with other women with PCOS, join support groups, or talk to a therapist. When you connect with these like-minded people, you will be able to have a stable life. You will know that you are not alone, and you will know that you should not feel bad about yourself. Then you need to prioritize your self-care. You need to take care of your physical and emotional health. All these things can affect your emotional well-being. And once it does, you notice that some people will not care about their outlook anymore. So please, you need to prioritize self-care. Then you need to work with your healthcare provider. By collaborating with your healthcare provider, you will develop a personalized treatment plan. So the healthcare provider will be able to develop a personalized treatment plan for you. So please don't feel that a particular drug that works for you should work for another person. It does not work that way. Please let the people who have signs and symptoms that are related to yours go to the hospital. Don't diagnose them with PCOS. Let it be done by the medical doctor.